Hi, I'm Elizabeth Velasquez. I'm a nurse practitioner student.
Nice to meet you. I'm Sarah.
Sarah, just to confirm for my confirmation, what is your full name and your date of birth?
Sarah Goodman, January 1st, 1990.
And what brings you today to the
I'm
clinic?
having a lot of abdominal pain and constipation.
Okay. And when did this start?
Oh, about a month ago.
Okay. And how does it feel? Does it feel dull, like the pain, or aching, or sharp?
At times it's achy and then it's sharp and I'm really bloated, I feel.
And is there anything that relieves the pain?
Not really.
Is there anything that makes it worse?
It seems the more I eat, the worse it gets.
Oh, and is there a time of the day where it gets better or worse?
It's worse at night.
Is that worse at night? Okay, how long does the pain usually last?
Oh, hours.
Hours?
Yeah.
Okay. And what would you rate the severity of pain from 1 to 10?
About a 6.
6. Okay. So before I further examine you, I'm just going to ask you some questions because it's my first time meeting you. I'm going to ask about your family history. So your mom, dad, and or brothers and sisters, do they have any serious health concerns like cancer, heart disease,
No.
No, any gastrointestinal issues, like issues with their stomach or bowels?
No.
Okay, and I'm just going to ask you some things about yourself because I want to get to know you. So, first of all, are you married?
Yes.
And do you have any children?
I have 2.
2 children, okay. And do you work?
I work at a bank. I'm a manager.
Oh, okay. And how do you like that?
I like it, but it's very stressful. My boss seems to think that I can do my job plus extra, so he puts a lot on me.
Oh, okay. And that's, yeah, that's definitely not easy. Are you on any medication?
No. Vitamins.
And I gotta ask also herbs. We often forget herbs are natural things. Are you taking any naturopathic things?
No.
And do you smoke?
No.
And do you take illicit drugs, and that includes marijuana?
No.
And do you drink alcohol?
Occasionally, but not anything on a regular basis.
Okay, so I'm just gonna check your vital signs and see where that is. And I'm also gonna check and temperature is this, and it's 36.1, which is 97 Fahrenheit. And yeah, your blood pressure is 120/80, and your SpO2 is 99%. That's good. And now I'm just gonna listen to your lungs. Okay, so I'm just gonna start from the front, and when you see my stethoscope, please, when you feel it, take a breath, okay? Here goes. And I'm just gonna go to the back. Okay, and now when you feel the stethoscope, take a breath. Thank you. And I do hear good air entry through both the lobes bilaterally. No crackles or vintageous sounds. I'm just gonna check your heart, okay? So I'm gonna landmark the second intercostal space, right sternal border is the aortic pulse, and I do feel it strong, beating regularly. The second intercostal space, left sternal border, pulmonic pulse, also sounds good. Third intercostal space, left sternal left midclavicular or left sternal border also equal. This is Erb's point, where S1 and S2 are equal. And this is the apex, which is the midclavicular line. Fifth intercostal space, left sternal border, and pulse is regular. And then I can go with my bell and also listen for any murmurs, which I'm doing. And I don't hear any murmurs, so that's good. Now we're just going to examine your abdomen. And I also forgot to ask if there's any blood in your stool.
No, not that I've noticed.
Okay, and if you lay down here, first I'm just going to start with, I'm going to tell you what I'm going to do, which is going to look so I can see your abdomen, okay? And, okay. So I'm just noticing anything that looks like it's symmetrically, it's bilateral, symmetrically, umbilicus is in line. I'm not seeing any abrasions or anything like that. And it looks like, yeah, so everything, skin tone is consistent throughout. So now I'm just gonna, and let me know if you're feeling any pain. We're gonna listen through the 4 quadrants. So I'm gonna listen with my diaphragm in 3 spots. And I'm gonna listen for, usually there's 5 to, per minute, or up to 20 sounds. And I'm hearing some sounds here. I think you just had lunch. And here I listen. And it sounds, yeah. Okay, and this side. And if I didn't hear any sounds, I would listen for 5 minutes before I said that there was no vowel sounds. But I'm hearing normal vowel sounds. So now I'm going to percuss. Okay, let me know if you're feeling any pain or anything. Okay. So I'm gonna again go through the right side, and I hear some dullness here, and then hyperresonance here. And now I'm going to palpate. First I'm going to start with some light palpation again. Oh, and I forgot to ask you, where is the location of your pain when you do have pain?
Right in here.
And are you in pain right now?
A little discomfort.
So we usually leave the last part that's in pain when we touch the glass. So just going to gently palpate. Any pain or tenderness I'm feeling for any masses, any abnormalities under the skin. And here, I'll just be really gentle. Okay, and then we do deeper palpation. Okay, so just going to go a little bit deeper. Any pain or tenderness. I'm not feeling any masses here. A little bit.
A little bit there.
Okay. And then we're just going to check your liver. So what I'm going to do is I'm going to go under here. And I'm going to go like this gently. And usually you can just feel the tip. Unless someone has an enlarged fatty liver, and you usually can't feel a gallbladder, and I can't feel it, or possibly cirrhosis of the liver. And I'm just going to do the costal, it's called the costal vertebral angle. So if you sit back up on that, and I'll cover your abdomen here. And then if you tell me if this hurts, okay?
Well, my leg's over here.
Oh, I can, oh yeah, sure. And then, so I look for the costume when to go and go. Okay, and tell me if she hasn't expressed that she feels anything here, so did that hurt at all?
No.
And how about this? And
Nope.
okay. So what I'm gonna do is, I didn't ask you, when was your last bowel? Because you're mentioning you're having
4 days ago.
4 days ago. Okay. So I think what we need to do is I'm gonna give you some free samples of the polyethyl glycol 30 PEG, also under a brand name Restorelax, and I'll give you like a 2-month supply. So take that every day and turn 50 mLs of water. And then I want you to, if your symptoms worsen, to give our office a call. Otherwise, I'm going to see you in like 3 weeks, okay? So make an appointment. And also want you on a high fiber diet. So our nurse, she has a booklet of nutrition, and she'll give you the foods that you need. Okay, so I think it's just a matter of like making sure everything is moving, because it did sound a little bit hypo, the vowel sounds are a little bit hypo, so things aren't moving as good as they could be. Okay, do you have any questions for me?
I don't think so.
Okay, well, it was a pleasure to meet you, Sarah.
I appreciate your help.